Are you struggling with the constant ringing in your ear? Let's break down the core principles behind effective tinnitus treatment. I find that this information is so scattered and complicated. In this video, my intent is to provide you the principles behind tinnitus treatment. Welcome. My name is Dr. Kundlas, and I'm a primary care physician for last 27 years. I have special interest in tinnitus and have done a lot of research and kept myself educated about tinnitus. If you want to know about the other aspects of tinnitus, please watch our playlist. Today, we will explore the principles underlying the tinnitus treatment. Number one, treat the treatable. We know for a fact if you lose your hearing and sometime if you're deaf to certain frequencies of sounds which may not give you an apparent feeling that you are having a hearing loss can lead to tinnitus. Every tinnitus patient should be seen by a high quality audiologist and they should have proper hearing tests done. If we find any kind of hearing loss, whether it's gross or to certain frequencies, your audiologist can provide you with the hearing aids which will provide your brain the missing link or missing stimulus for those frequencies. Once your brain starts getting input, your tinnitus goes down. Second, cochlear transplants. In very severe cases of hearing loss, cochlear transplants can be revolutionary and they could help you. Second principle about tinnitus treatment is modify the response to this annoying tinnitus sounds. Everybody has a different kind of a sound, but if you could create a space between stimulus and response, meaning these annoying sound is a stimulus and that provokes a lot of physical, cognitive and emotional responses. If you start seeing yourself through biofeedback, meditation, or any other technique you will employ, then you could modify the response to these annoying sounds. Common name for this principle is called cognitive behavior therapy. Once you learn and see these sounds, how they're affecting you, seeing yourself being getting affected by this frees you up. And that is the fundamental principle behind meditation, no matter which kind of tradition you pick it up. Third principle is sound treatment. We know for a fact your brain is missing certain sound frequencies or gross or fine. Once you provide your brain with those frequencies externally through sound which you enjoy and like, whether it's a music or through sounds generators or implantable devices, you retrain your brain how to respond to these sounds, and that is called tinnitus retraining treatment. Next principle is modifying tinnitus with alternative sounds. We know for a fact if you provide your brain alternative stimulus, it will shut up and your tinnitus frequency and severity will go down. Lifestyle changes, including good diet, regular exercise, proper sleep, avoiding stimulants, have a significant place in managing tinnitus symptoms. Alternative treatments like acupuncture, mindfulness, herbal supplements, supplements which contains ginkgo, melatonin, zinc, magnesium, they all have been tried and they do help certain people. Seventh principle is medications. Pharmaceutical medications have definite role in helping you to aid or to cope up with the tinnitus symptoms. Antihistamines, antiemetics, anti-anxiety medications, antidepressants, all these medications do help. My goal in this video was to provide you the principles. Principles are if your tinnitus is due to hearing loss, let's get our hearing tested and go for hearing aid. If you cannot do anything, let's understand how it's affecting us and change our response to this stimulus, provide our brain with alternative sound stimulus which we like and cope up with so that we could suppress these tinnitus sounds, make ongoing lifestyle changes, use alternative treatments and pharmacological treatment if needs to be. Thank you for watching. Please like, share and subscribe. Please watch this whole playlist on tinnitus. And thank you very much, and I will see you in next video.